Yes.
Okay. All right. I apologize for my technical difficulties there. All right. So thank you again for this opportunity. So, brief introduction. Children's Heart Link had commissioned an evaluation of the nursing education activities over the last 8 years. And Children's Heart Link and PCI have partnered since 2014 to organize the nursing track at this annual conference. A lot has been accomplished through collaboration and including professional development, nursing empowerment, and leadership development, as both Nisha and Lalita alluded to. And so that was a good introduction here. An evaluation summary report of the impact of these efforts and recommendations for the future have been developed. We embarked on a study to look at these efforts, and the methodology included a basic qualitative study, a review of literature, look at previous interviews that had been conducted for other purposes, and this study included interviews of 8 pediatric cardiac nurses and nurse leaders across India. And I just wanted to share the demographics to show that we really purposefully looked for nurses across the spectrum. We wanted nurses who were a variety of age ranges, education, current designation, years of experience in nursing, and years of experience as cardiac nurses to provide responses that really showed a variety of interests and backgrounds, so that we could understand really from everybody across the spectrum how they felt about nursing and pediatric cardiac nursing and nurse leadership in India. So the themes that came out of this study really echo a lot of what Nisha and Lalita talked about. The first theme was education. And underneath that, our first sub-theme was an update to the nursing curriculum. Again, echoing what my esteemed colleagues talked about. Participants agreed that the basic nursing curriculum for A&M, G&M, and BSc nurses really needs to be updated. They talked about the fact that the curriculum really focuses on community care rather than hospital care, and it really needs to focus on critical thinking and nursing theory. One of the comments was that nursing colleges are not educating them, so we have to train them. Exposure to the hospital is not in most of the colleges. The participants also noted that certainly updating the curriculum is a big undertaking that will take time, but updating the nursing education curriculum will bring more value to nursing as a profession, and that's why it's so important. Continuing on our theme of education, Children's Heart Link's contributions to providing the initial pediatric cardiac education is very significant. However, participants noted that there's a lack of continuing education and advanced education in this area, which they really desire, as do their colleagues. One participant said, "We take BLS and ALS and we renew that, but we don't do the same for clinical nursing. We should have the same requirements for clinical and leadership." I thought that quote was really telling about their desire for continuing education in those areas. The next sub-theme was leadership development. Participants agreed that there is really a lack of leadership development programs and resources in India to support them. So they mostly developed through mentoring and role models. One participant noted that it was a drawback for her not having access to the library and no internet. At her hospital, only physicians could take books from the library. So she showed some interest in leadership and was guided by nurses. Another participant said, "I didn't plan it. I never attended any courses, but I am recognized at this institution and I am ready to develop." So clearly there's a desire to develop as a leader, but there is a lack of ability to find resources and courses to be able to develop. The next theme is value of nursing. We'll start with the sub-theme of value to the public. As Nisha and Lalita alluded to, the nurses are not valued in India, though they might be a little bit more valued now with COVID than they were previously. Participants commented, movies show nurses badly, not respectfully. Even nurses know they have a low profile. Nurses are treated poorly. It is not a high-class job. However, one comment showed that it might be shifting. Now with COVID, they, nurses, are becoming more popular. Nurses are providing care to the people. The next subtheme is value to hospitals. There were a variety of responses to this subtheme showing an evolution in how nurses are viewed within the hospital. So more than half of the participants said that physicians valued nurses within the hospital with statements such as, nurses are valued greatly in our hospital system. After COVID is a positive sign that administrators, healthcare, and others are valuing nurses. Then I begin to see a shift in responses with, there are certain doctors who appreciate nurses. If mistakes happen, they don't automatically blame the nurse. Then less than half the participants said that physicians did not value nurses, with statements such as, if there are problems, the blame is on nursing and not on other categories. And nursing is seen as subservient, menial. They are picking up after doctors. Until this changes, nurses won't be valued. So you can see that fewer nurses are talking about physicians not valuing nurses, and the shift is to more than half the participants saying that physicians are valuing nurses. This leads into value to hospitals and pay and benefits. Pay and benefits, participants noted, are driven by the public perception of nursing as a profession, the value to nursing in the hospital, and the value of nursing to the government. The government and Indian Nursing Council set the pay scale for government nurses, and these organizations are overseen by physicians and hospital administrators. Participants pointed out that until these organizations are overseen by nurses, this is unlikely to change. One participant commented, the pay for nurses is about 10% of a doctor's salary. Another participant commented, we need a standard of working hours and better benefits. This ties into promotions. In the government sector, promotions are exclusively based on seniority. Thus, there is no incentive for self-improvement, knowledge gain, or education. In private hospitals, this is different. The method of promotion varied from one to another, and it was not based solely on seniority. Participants agreed that having promotions based on expertise, formal education, continuing education, training, specialty training, and so on, would enhance job satisfaction and retain nurses, and that promotions should be merit-based. Tying promotions to a pay increase was important to participants as well. One participant commented that even if you further your education, you won't be promoted because of it. Then what have you accomplished? It's why younger nurses don't want to do it. So now that we've heard some of what the participants said and the common themes, what are the recommendations? Pediatric cardiac nursing education at all levels for nurses who care for these patients should be done. Pediatric cardiac nursing education for nurses who refer these patients. So nurses in urban hospitals who would care for these patients and refer them to surgery should be done. In addition to general pediatric cardiac nursing education for nurses at any facility. So really broadening where pediatric cardiac nursing education is offered. And then nursing leadership education for all nurses who work in pediatric cardiac nursing should be offered as well. Program development, basic nursing leadership education for nurses who desire to be a shift in charge should be developed, and then advancing nursing leadership education programs for nurses as they move up the career ladder. Additionally, programs for nurses who want to work in other nursing roles like nursing education and nursing research. So who could lead this? Children's HeartLink in collaboration with PCSI and the Association for Nurse Executives in India would be the likely choice to lead these efforts. There are also recommendations for advocacy, as we talked about with updating the nursing curriculum, with supporting nursing as an independent profession, not dependent on doctors' orders, as with nursing, overseeing nurses, with ICN and government nursing organizations, advocating for higher nursing pay, developing nursing leadership education and a career ladder for nurses to increase job satisfaction and retain nurses in India, and supporting nursing education requirements for nursing and pediatric nursing to continue for nurses growing in their profession. In conclusion, significant contributions have been made over the last 10 years, which participants were strong in pointing out. However, there's room for growth in continuing education in pediatric cardiac nursing and nursing leadership in India. PCSI can collaborate with others to advocate for enhancing nursing school curricula, nursing being an independent profession, having nurses oversee nurses. I want to thank you for your taking time to listen to me this morning and the opportunity to present these findings. Thank you.
Thank you, Madeline. Thanks for